Next, let us look at how distribution to cells occur. Okay. So, once a drug has reached the tissue, it can be immediately effective if the target site is a receptor situated on the cell membrane. So, we already know that if the target for a drug is a receptor, right. So, this acts on this and immediately there is a signal that is passed on, and that can lead to, for example, neurotransmission, and that will be the desired outcome. Okay. But there are many drugs that have to enter the individual cells, okay, of these tissues in order to reach their targets. So, in this case what happens is the drug, let us say the target is here, the drug has to get across this membrane and then act on its target. Okay. So, some of these include local anesthetics, enzyme inhibitors, because enzymes are present within the cell, and so if you design a molecule or a small molecule as an inhibitor of an enzyme, then it has to get across the cell membrane, go hit the enzyme and then bind to it and then inhibit it. Okay. And of course, there are drugs which act on the nucleic acids, right, and those again have to get across the cell membrane, and in the case of mammalian cells, they will have to get across the nuclear membrane, get into the nucleus and then bind to it. And we already looked at that not all receptors are extracellular receptors, and there are some important intracellular receptors which drugs can hit. So, again to act on these, the molecule has to get across the cell membrane, right. So, such drugs which have to pass cells must be hydrophobic enough to pass through the cell membrane. We have already looked at a number of examples of why the molecule should be hydrophobic, and unless they are smuggled through by what are known as carrier proteins, right. So, carrier proteins can, what they can do is they can bind to the drug and take it along with it. When the protein gets across the membrane, they can take along with it this small molecule. Or the last way in which they are taken in is by a process known as pinocytosis. Let us now look at what pinocytosis is. That occasionally there are polar groups with high molecular weight that can cross the cells of the gut, okay, without actually passing through the membrane. So, this process is known as pinocytosis, right. So, the cartoon that shows it describes it is shown here. So, you have a drug molecule that goes and interacts with this membrane, and then there is an invagination in the membrane which then forms a vesicle, and then subsequently it is transported to the other side, and then the drug is passed through the cell. Okay. So, it is a process by which the drug is engulfed and pinched off to carry the drug to the other side. So, there are other factors of course that are important. The concentration levels of the free drug circulating in the blood supply rapidly fall away after administration of as a result of the distribution patterns described above. So, what it means is that once you administer the drug, then the drug concentration of the drug in the blood will go up. So, let us say on the y axis we have concentration of drug in the blood. So, at t equals 0, it is 0, then it goes up, right, and then after some time what happens is that it starts distributing through these capillaries, it gets across and starts going into various tissues. So, it is expected to go down over a period of time. Okay. But drugs that are excessively hydrophobic are absorbed into fatty tissues and they are removed from the blood supply. So, they are not available to pass around inside the blood, right. And so, fat solubility can lead to many various problems. Okay. So, we looked at it earlier that a highly hydrophobic molecule can get into fat globules, right. And for example, in obese patients, these are people who are excessively fat beyond the normal range, and sometimes they undergo surgery. Okay. And what happens is that when they undergo the surgery, they require a larger than normal amount of general anesthetic, because their body weight is excessively high. So, when you give this general anesthetic, because general anesthetics typically contain these gases which are particularly fat soluble. Okay. So, what happens is that after the surgery, this anesthetic gets across the body and gets into the fat area where there is a lot of fat. Okay. So, once this surgery is completed, then the patient will regain consciousness because this anesthetic is not available anymore. but then because there is a lot of anaesthetic stored in the fatty tissues, they will then be released slowly, and then because of that the patient can become unconscious again. So, therefore, when we are administering a general anaesthetic to particularly obese people, one needs to keep this in mind when they are doing it. Okay. Ionized drugs again may have other problems. Okay. They may bind to various macromolecules, and also they may be removed from the blood supply. Okay. So, once you are removed from the blood supply, then it is not very useful. So, drugs may also bind reversibly to blood plasma. So, there is a very important albumin protein which is called as the serum albumin, which can bind to a number of drug molecules, and this lowers the level of free drug that is available to interact with the target. So, only a small proportion of the drug that has been administered may actually reach the desired target. So, in this entire description that we have looked at today, what we are trying to explain to you, or what I am trying to explain to you, is that once we take a capsule or a pill, it gets into the stomach, it gets into the intestine, and then it gets into the blood supply and so on, but only a fraction of the drug may actually reach the desired target. So, large amount of the drug may actually be either excreted or going or being transported to a region which is not very important and so on. Okay. Now, there is another important factor when we are considering various organs in the body. One of the most important organs that we have is the brain, and the brain is actually protected quite a bit from the rest of the body. So, by what is known as a blood-brain barrier. Okay. So, what happens is that if one wants to send a drug to the brain, then it has to cross what is known as a blood-brain barrier, or it has to negotiate this barrier. So, the blood capillaries that feed the brain are lined with very tight filling cells. So, normally we were looking at the intestine lining cells. So, there are many pores through which it goes, but in the brain these are actually very tightly filled, and therefore, there are no pores that are really available for the drug to pass through. Okay. So, the capillaries are coated with a fatty layer. Okay. So, there is also formed from nearby cells, and this provides an extra fatty barrier through which drugs have to cross. So, not only do they have to cross the membrane, but they also have to cross this extra fatty layer. So, drugs entering the brain have to dissolve through the cell membrane of the capillary and also through the fatty cells coated with these capillaries. So, for example, the drug that we looked at is penicillin. So, penicillin is not does not enter the brain easily because it is quite polar. Right. So, the existence of the blood-brain barrier makes it possible to design drugs that will affect various parts of the body, but have no activity on the brain, because this is very important, because the brain is quite susceptible to side effects. Right. So, if the drug is designed such that it does not cross the blood-brain barrier, then the central nervous system is actually spared of the side effects. Now, the way we can do it is to increase the polarity of the drug such that it does not cross the blood-brain barrier. Okay. However, keep in mind that if we have to make a drug that is supposed to go to the brain, then we should be able to design it in such that they are able to cross the blood-brain barrier. Okay. So, some polar drugs can actually cross the blood-brain barrier with the help of what are known as carrier proteins, okay, while others can actually go across by the process of pinocytosis, which is described previously. The ability to cross the blood-brain barrier has an important bearing on analgesic activity of opioids. Okay. Now, there is another barrier, especially in pregnant women, where the fetus is growing and the fetus must be spared of a number of processes that happen in the mother. So, the placental membrane forms a very important barrier. So, the placental membrane separates a mother's blood from the blood of her fetus. So, the mother's blood provides the fetus with essential nutrients like oxygen and all other nutrients, and it also carries away waste products from the fetus. Okay. But these chemicals must pass through what is known as a placental barrier. So, as the food and waste products can pass through this barrier, it is perfectly feasible for drugs also to pass through this. So, many drugs such as alcohol, nicotine or cocaine can all pass through the fetal blood supply, right, and fat soluble drugs will cross the barrier very easily, right, and drugs such as barbiturates, which are sometimes which are consumed as addictive agents, will reach the same level in the fetal blood as in the maternal blood. So, these are pretty dangerous to be consuming during pregnancy, right. So, if some of these are not known or not obvious, but sometimes they may prove hazardous once the baby is born, right. So, once these drugs or toxins enter the fetus, the mother's blood can pick it back up and detoxify it. But once the baby is born, it may still have some of the levels of the drug in its blood, but it does not have the mechanism to detoxify or eliminate them. So, it is possible that drugs with a long half life or a lifetime may have fatal effects on the fetus. So, these are some things that we need to consider when we are dealing with pregnancy or drugs that are going to have an effect on the mother who is carrying a fetus. Another important aspect is the interaction between drugs. Okay. So, drugs such as warfarin, whose structure is shown here, are bound to albumin and plasma proteins. We already looked at this, that plasma proteins can bind to certain drugs and therefore, they are not available to interact with their targets. But now, when you take another drug, okay, this drug can actually come and compete for the plasma protein binding. So, the example here is sulphonamides, which were used as antibacterial agents. Now, once the drug is bound here, once there is a competition from another drug, this first drug starts to get out. Okay. So, once the previously bound drug is released, the increased concentration of the drug is actually results, right. And so, this drug, the warfarin, may actually have an effect which is unexpected when you take it with sulphonamides molecule behind.